Hi, this is Dr. Dumestre, and I wanted to discuss what happens when you have a failed DIEP flap. So that is that same person transplant for breast reconstruction, taking the belly fat, transferring it up to the chest, and the way it survives is it comes with an artery and a vein that's hooked up to an artery and the vein in the chest that constantly gives it blood flow. Now, flap loss or failure happens when there's problems with either the inflow of blood through the artery or the outflow of blood through the vein. That can be a clot, it can be a kink, it can be due to clotting disorders, or can be due to position of the flap, swelling, a variety of different issues, but most commonly it's a clot or a kink. So this is a devastating complication. You've been through a huge surgery, and now one of them doesn't work. That piece of tissue is now dead. So there's no recouping that exact same donor site. Now, that being said, there are often different options available. It depends where you're at in this country as far as finding surgeons who can do these different options. But there are other natural tissue donors that can be used if you really do not want implants. So examples can be your inner thigh tissue or a pap flap, the low back tissue or a lap flap. There's gluteal tissue that can be used as well. Or if you don't want any more free flap surgeries, so kind of like I've taken the risk with that first one, it didn't go well, I can't imagine going through that all again, then another option is to take your latissimus, so your back, skin, and muscle, and transfer it. And sometimes with fat grafting that, with liquid fat transfer, you can get a pretty decent size and look quite nice without the need for an implant. So all that to say, sometimes implants are the only option, but if it's really important to you to have a natural tissue reconstruction, you should have some other options available to you.